Question 1. A nurse is preparing to administer a new medication to a patient. The patient states, "This pill looks different from what I usually take." What is the most appropriate initial nursing action? A. Administer the medication as prescribed, assuming a generic version was dispensed. B. Tell the patient not to worry, that medications sometimes change appearance. C. Recheck the medication order against the patient's current medication and pharmacy record. D. Document the patient's concern and notify the prescriber after administration. Answer: C. Recheck the medication order against the patient's current medication and pharmacy record. This question tests a crucial aspect of medication safety, the right drug and right patient principles. The keyword "most appropriate initial nursing action" indicates a need for immediate verification when a patient expresses concern about their medication. It is essential to always recheck the medication order against available records to confirm it is indeed the correct drug for the patient, as a different appearance could signal a change in formulation, a dispensing error, or even a wrong medication. For instance, if the drug name or dosage doesn't match the order, a potentially harmful error could be prevented. Always trust a patient's instincts and verify before administering any medication. Question 2. A nurse enters a patient's room and finds them on the floor next to the bed. The patient is conscious and complaining of hip pain. What is the nurse's immediate priority? A. Call the patient's family to inform them of the fall. B. Assist the patient back into bed to prevent further injury. C. Assess the patient for injuries and vital signs. D. Complete an incident report after the patient is stable. Answer: C. Assess the patient for injuries and vital signs. This question assesses the nurse's prioritization skills in an emergency, focusing on the immediate aftermath of a patient fall. The phrase "immediate priority" emphasizes the need to ensure patient safety and identify any harm. Before moving or calling anyone, the nurse must first assess the patient for any injuries, such as fractures or head trauma, and check vital signs to determine their physiological stability. For example, moving a patient with an unknown fracture could cause more damage. Always remember that immediate assessment to identify and address physical harm is the paramount first step after any patient fall. Question 3. A patient with a newly inserted nasogastric (NG) tube is prescribed an oral medication. The nurse notes the medication is an enteric-coated tablet. What is the most appropriate action? A. Crush the enteric-coated tablet and administer it through the NG tube. B. Dissolve the enteric-coated tablet in water and administer it through the NG tube. C. Administer the enteric-coated tablet orally, as it is designed for oral intake. D. Hold the medication and contact the prescriber for an alternative order. Answer: D. Hold the medication and contact the prescriber for an alternative order. This question tests the nurse's knowledge of safe medication administration and the properties of different drug formulations. The keyword enteric-coated tablet is a critical clue because these medications are specifically designed to dissolve in the intestines, not the stomach, to prevent gastric irritation or protect the drug from stomach acid. Crushing or dissolving an enteric-coated tablet would destroy its protective coating, making it ineffective or potentially harmful, and it should never be administered via an NG tube. For example, if crushed, medications like aspirin that are enteric-coated could cause stomach ulcers. Always respect drug formulations and seek clarification from the prescriber if a conflict arises with the administration route. Question 4. A nurse is caring for a patient who is refusing a prescribed antibiotic, stating, "I don't believe in taking medicine." What is the most therapeutic response by the nurse? A. You have to take this medication, the doctor ordered it for your infection. B. If you don't take your antibiotics, your infection will get worse. C. Can you tell me more about your concerns regarding medications? D. I will document your refusal and notify the doctor. Answer: C. Can you tell me more about your concerns regarding medications? This question assesses therapeutic communication and respect for patient autonomy. The keyword most therapeutic response indicates the need for an open-ended, non-judgmental approach that encourages the patient to express their feelings and concerns. This allows the nurse to understand the patient's perspective and address any misconceptions or fears about the medication, rather than simply stating facts or issuing warnings. For example, the patient might have cultural beliefs or past negative experiences that need to be understood. Always use open-ended questions to facilitate dialogue and promote shared decision-making in patient care. Question 5. A nurse is performing wound care for a patient with a stage 2 pressure injury. Which finding indicates the wound is healing appropriately? A. The wound bed is covered with eschar. B. The wound is larger than the previous measurement. C. Pink, healthy granulation tissue is present in the wound bed. D. There is purulent drainage from the wound. Answer: C. Pink, healthy granulation tissue is present in the wound bed. This question tests the nurse's ability to assess wound healing and distinguish normal healing from complications. The phrase "healing appropriately" is the key indicator for identifying positive wound changes. The presence of pink, healthy granulation tissue, which looks like tiny, fleshy bumps, signifies that new connective tissue and capillaries are forming, which is a vital step in the reconstructive phase of wound healing. For example, a wound that progresses from red and open to having a vibrant pink-red, granular appearance indicates effective tissue repair. Always recognize healthy granulation tissue as a positive sign of healing, moving towards wound closure. Question 6. A nurse is preparing to administer a tuberculin skin test, PPD. Which angle of injection is appropriate for this procedure? A. 15-degree angle. B. 45-degree angle. C. 90-degree angle. D. 60-degree angle. Answer: A. 15-degree angle. This question assesses precise medication administration techniques, specifically for an intradermal injection like a PPD. The key is knowing the correct angle for injecting into the dermis, which is the layer just below the epidermis. A 15-degree angle, with the bevel of the needle facing up, ensures the medication is deposited superficially into the skin, creating a wheal, small bump, necessary for accurate test results. For example, if injected too deeply, the wheal won't form, and the test result might be inaccurate. Always remember that the 15-degree angle is unique to intradermal injections to ensure the medication stays within the skin layers. Question 7. A patient with chronic obstructive pulmonary disease, COPD, requires oxygen therapy. Which statement indicates the patient understands the safest use of oxygen at home? A. I will increase my oxygen flow rate if I feel short of breath. B. I should keep my oxygen tank near a heat source for warmth. C. It's safe to smoke if I'm not directly touching my oxygen tubing. D. I will keep my oxygen away from open flames and heat. Answer: D. I will keep my oxygen away from open flames and heat. This question focuses on patient education regarding oxygen safety in the home environment. The keyword safest use highlights the need to identify the correct safety precaution for a highly flammable gas. Oxygen significantly intensifies combustion, making it a fire hazard, so keeping it away from any open flames, sparks, or heat sources is paramount to prevent serious accidents. For instance, a patient should avoid smoking, candles, and gas stoves while using oxygen. Always emphasize that oxygen is a fire accelerant and requires strict safety measures around any heat or flame. Question 8. A nurse is caring for a patient who has been diagnosed with Clostridium difficile, C. diff. Which type of isolation precautions should the nurse implement? A. Droplet precautions. B. Airborne precautions. C. contact precautions. D. Standard precautions only. Answer: C. Contact precautions. This question tests the nurse's knowledge of infection control and the appropriate isolation precautions for specific pathogens. Clostridium difficile is a highly contagious bacterium that causes severe diarrhea and is primarily spread through direct contact with contaminated surfaces or infected feces. Therefore, contact precautions, which include wearing gloves and a gown upon entry to the room, are essential to prevent its transmission. For example, washing hands with soap and water, not just alcohol-based sanitizer, is crucial after caring for a C. diff patient, as alcohol is not effective against its spores. Always remember that C. diff requires dedicated contact precautions to contain its spread effectively. Question 9. A nurse is assessing a patient's pain level using a numerical rating scale. The patient rates their pain as an 8 out of 10. Which is the most appropriate action for the nurse to take next? A. Document the pain score and reassess in 4 hours. B. Administer prescribed PRN pain medication and reassess its effectiveness. C. Tell the patient that an 8/10 is very high and they should try to relax. D. Notify the healthcare provider of the high pain score. Answer: B. Administer prescribed PRN pain medication and reassess its effectiveness. This question assesses prioritization in pain management. The keywords pain as an 8 out of 10 and most appropriate action for the nurse to take next indicate a need for immediate intervention for severe pain. When a patient reports high pain, the priority is to alleviate their discomfort by administering any prescribed as-needed PRN pain medication, followed by reassessing its effectiveness within an appropriate timeframe. For example, if a patient has an order for an opioid analgesic, the nurse should give it promptly rather than just documenting or waiting. Always remember that acting on severe pain reports with available interventions is a core nursing responsibility. Question 10. A nurse is educating an elderly patient about medication safety at home. Which instruction is most important to prevent accidental overdose? A. Store all medications in a clearly labeled pill organizer. B. Keep medications in their original, child-proof containers. C. Discard expired medications by flushing them down the toilet. D. Take medications at the same time every day. Answer: B. Keep medications in their original, child-proof containers. This question focuses on medication safety, particularly for vulnerable populations like the elderly. The keyword most important to prevent accidental overdose highlights a key protective measure. While pill organizers are useful, keeping medications in their original, child-proof, and often senior-friendly containers with clear labels is crucial to prevent confusion, accidental ingestion by others, and to maintain drug integrity. For instance, if medications are transferred to unlabeled containers, an older adult could easily mistake one pill for another or take an incorrect dose. Always emphasize using original, labeled containers to ensure clear identification and reduce the risk of errors. Question 11. A nurse is caring for a patient who develops sudden shortness of breath and chest pain. The nurse notes rapid, shallow breathing and a drop in oxygen saturation. What is the most appropriate initial action? A. Administer a bronchodilator. B. Obtain a full set of vital signs. C. Elevate the head of the bed and apply oxygen. D. Notify the healthcare provider. Answer: C. Elevate the head of the bed and apply oxygen. This question tests prioritization in a rapidly deteriorating respiratory situation, emphasizing the ABC, airway, breathing, circulation, principle. The keywords sudden shortness of breath, chest pain, rapid, shallow breathing, drop in oxygen saturation, and initial action all point to an urgent need to improve oxygenation. Elevating the head of the bed improves lung expansion, and applying oxygen directly addresses hypoxemia, which are immediate interventions that can stabilize the patient before further assessment or notification. For example, a patient struggling to breathe needs immediate oxygen support, not just assessment. Always prioritize interventions that directly improve a patient's breathing and oxygenation in acute respiratory distress. Question 12. A nurse is preparing a sterile field for a dressing change. Which action by the nurse would contaminate the sterile field? A. Touching the outer 1-inch border of the sterile field with sterile gloves. B. Placing sterile items within the 1-inch border of the sterile field. C. Turning their back on the sterile field to retrieve additional supplies. D. Holding sterile forceps above the waist level. Answer: C. Turning their back on the sterile field to retrieve additional supplies. This question assesses knowledge of sterile technique and common actions that break sterility. The keyword contaminate the sterile field requires identifying an action that introduces microorganisms. Turning one's back on a sterile field makes it impossible to visually monitor the field, meaning any accidental touch or airborne contaminants are unseen, rendering the field non-sterile. For example, if a nurse walks away from the field, they cannot confirm if someone brushed against it or if it was exposed to unsterile air currents. Always maintain constant visual contact with a sterile field to ensure its integrity. Question 13. A patient asks the nurse, "Why do I have to get out of bed every day when I'm so weak?" The nurse's response should be based on the understanding that early ambulation primarily prevents which complication? A. Increased pain perception. B. Urinary tract infections. C. Deep vein thrombosis, DVT. D. Muscle spasms. Answer: C. Deep vein thrombosis, DVT. This question tests the nurse's understanding of the benefits of early ambulation and its primary physiological impact. While early ambulation can help prevent other issues like UTIs and pneumonia, its most critical role in hospitalized patients, especially those who are weak or post-surgical, is preventing deep vein thrombosis, DVT. Immobility leads to venous stasis, slowed blood flow, which significantly increases the risk of blood clot formation in the legs. For instance, even short walks can help activate the calf muscle pump, which aids venous return. Always remember that preventing DVT through movement is a key reason for early ambulation post-illness or surgery. Question 14. A nurse is conducting discharge teaching for a patient prescribed a new oral anticoagulant. Which food or supplement should the nurse instruct the patient to limit or avoid? A. Oranges and other citrus fruits. B. Green leafy vegetables. C. Dairy products like milk and cheese. D. Over-the-counter pain relievers such as acetaminophen. Answer: B. Green leafy vegetables. This question assesses critical patient education for medication management, specifically for anticoagulants like warfarin. The keyword limit or avoid points to dietary interactions. Green leafy vegetables are high in vitamin K, which plays a vital role in blood clotting and can counteract the effects of anticoagulants, potentially reducing their effectiveness and increasing the risk of blood clots. For example, consuming large, inconsistent amounts of spinach or kale could make warfarin less effective. Always emphasize consistent, moderate intake of vitamin K-rich foods for patients on anticoagulants, rather than complete avoidance, unless specifically instructed. Question 15. A patient reports dizziness when standing up quickly. The nurse assesses the patient and notes a blood pressure drop from 120/80 mmHg to 90/60 mmHg when rising from a sitting position. What does this finding indicate? A. Hypertension. B. Orthostatic hypotension. C. Fluid volume excess. D. Vasovagal syncope. Answer: B. Orthostatic hypotension. This question tests the nurse's ability to interpret vital sign changes in relation to patient symptoms. The keywords dizziness when standing up quickly and blood pressure drop from 120/80 mmHg to 90/60 mm of mercury when rising precisely describe orthostatic hypotension, also known as postural hypotension. This condition is a sudden fall in blood pressure that occurs when a person assumes a standing position, leading to symptoms like dizziness or lightheadedness due to reduced cerebral blood flow. For example, elderly patients or those on certain medications often experience this. Always recognize a significant drop in blood pressure with positional changes as a hallmark of orthostatic hypotension. Question 16. A nurse is planning care for an immobile patient. To prevent skin breakdown and promote circulation, how often should the nurse reposition the patient? A. Every 4 hours. B. Every 6 hours. C. Every 8 hours. D. At least every 2 hours. Answer: D. At least every 2 hours. This question focuses on fundamental nursing care for immobile patients to prevent a common complication, pressure injuries. The phrase, to prevent skin breakdown and promote circulation, directly links to the rationale for repositioning. Repositioning at least every 2 hours is a widely accepted standard of care to relieve sustained pressure on bony prominences, which can lead to tissue ischemia and skin breakdown. For example, if a patient lies in one position for too long, blood flow is restricted, causing tissue damage. Always adhere to the guideline of repositioning immobile patients frequently to prevent pressure injuries. Question 17. A nurse is assessing a patient's pain using a pain scale. The patient denies pain but is grimacing and guarding their abdomen. What is the nurse's best interpretation of this situation? A. The patient is likely exaggerating their symptoms. B. The patient may be experiencing pain despite their verbal denial. C. The patient is probably just uncomfortable, not in pain. D. The nurse should only consider the patient's verbal report of pain. Answer: B. The patient may be experiencing pain despite their verbal denial. This question tests a nuanced aspect of pain assessment, emphasizing that pain is subjective and often expressed non-verbally. The key is to reconcile the denies pain with the objective signs of grimacing and guarding. Non-verbal cues can indicate pain even when a patient verbally denies it, possibly due to cultural factors, fear of addiction, or desire to avoid being a bother. For instance, an elderly patient might deny pain to avoid being seen as weak, but their body language tells a different story. Always integrate both verbal reports and non-verbal behaviors when assessing pain to get a complete picture. Question 18. A nurse needs to obtain a stool specimen for occult blood testing. Which instruction should the nurse give the patient? A. You can collect the specimen at any time, even if you have diarrhea. B. Make sure the stool specimen is free of urine contamination. C. You should consume a large amount of red meat before collecting the sample. D. The specimen should be collected after using a laxative. Answer: B. Make sure the stool specimen is free of urine contamination. This question focuses on the correct procedure for collecting a stool specimen, particularly for specific tests. The keyword occult blood testing is important because urine contamination can degrade the sample and lead to inaccurate test results, potentially causing a false positive or negative. Proper collection ensures the sample's integrity for accurate analysis. For example, if urine mixes with the stool, it can alter the pH and compromise the detection of hidden blood. Always instruct patients on how to collect a clean specimen, free from contaminants like urine or toilet paper, for reliable diagnostic results. Question 19. A nurse is preparing to administer medications to a patient with a history of allergies. What is the most important action the nurse should take before administering any medication? A. Ask the patient about their family history of allergies. B. Review the patient's medical chart for documented allergies and their reactions. C. Administer an antihistamine proactively to prevent a reaction. D. Inform the patient that allergies are rare with this medication. Answer: B. Review the patient's medical chart for documented allergies and their reactions. This question addresses a critical safety measure in medication administration, particularly for patients with a known allergy history. The phrase "most important action" highlights the absolute necessity of verifying allergies to prevent a potentially life-threatening anaphylactic reaction. Reviewing the patient's medical chart for documented allergies and the specific reactions provides essential information to ensure the prescribed medication is safe. For example, if a patient is allergic to penicillin, giving an antibiotic from the same class could trigger a severe allergic response. Always verify allergies and their specific reactions before administering any medication. Question 20. A nurse is caring for a patient who is experiencing acute confusion. Which intervention is most appropriate to help orient the patient? A. Place the patient in a room with minimal stimulation and no clock. B. Frequently reorient the patient to person, place, and time, and use a consistent routine. C. Restrain the patient to prevent self-harm due to confusion. D. Avoid discussing current events or the patient's diagnosis to prevent agitation. Answer: B. Frequently reorient the patient to person, place, and time, and use a consistent routine. This question focuses on nursing interventions for patients experiencing acute confusion or delirium. The keyword "most appropriate to help orient the patient" guides towards strategies that provide cognitive structure and stability. Frequent reorientation, along with maintaining a consistent daily routine and a calm environment with familiar objects, like a clock and calendar, helps to reduce disorientation and improve cognitive function. For instance, repeatedly stating "you are in the hospital, it's morning, and I am your nurse" provides grounding information. Always aim to provide a structured, predictable, and reality-based environment for confused patients. Question 21. A nurse is teaching a patient about performing ostomy care at home. Which statement indicates the patient understands how to protect the peristomal skin? A. I will apply a generous amount of lotion around the stoma to keep the skin moist. B. I should ensure the stoma appliance opening is cut slightly larger than the stoma. C. I will clean the skin gently with warm water and dry it thoroughly before applying the new pouch. D. I can use harsh soaps or alcohol to clean the skin around my stoma. Answer: C. I will clean the skin gently with warm water and dry it thoroughly before applying the new pouch. This question assesses patient education on essential ostomy care, specifically focusing on peristomal skin integrity. The phrase "protect the peristomal skin" is crucial for identifying proper care. Cleaning the skin gently with warm water and thoroughly drying it helps remove effluent without irritating the skin, creating an optimal surface for the adhesive barrier to stick effectively and prevent leakage. For example, leaving the skin wet could lead to skin breakdown, while harsh cleansers can cause irritation. Always ensure the peristomal skin is clean, dry, and free of irritants to prevent complications. Question 22. A nurse is conducting a home safety assessment for an elderly client. Which observation indicates the highest risk for falls? A. The client's medication bottles are clearly labeled. B. There is adequate lighting in the hallways. C. Loose throw rugs are present in the living room. D. Grab bars are installed in the bathroom. Answer: C. Loose throw rugs are present in the living room. This question targets the identification of fall hazards in the home. The phrase "highest risk for falls" directs the nurse to select the most impactful safety concern. Loose throw rugs are notorious tripping hazards, especially for elderly individuals who may have impaired balance, vision, or gait. These rugs can easily slide or bunch up, leading to a loss of footing. For instance, an elderly person shuffling their feet might catch their toe on a rug and fall. Always prioritize removing or securing tripping hazards like loose rugs to significantly reduce the risk of falls. Question 23. A nurse is educating a patient about collecting a 24-hour urine specimen. Which instruction is most important for the nurse to include? A. You can discard the first urine voided at the start of the collection period. B. Keep the urine collection container on the bathroom counter at room temperature. C. If you miss collecting a urine sample during the 24 hours, just estimate the amount. D. Collect every single void during the entire 24-hour period, including the last void at the end. Answer: D. Collect every single void during the entire 24-hour period, including the last void at the end. This question assesses the nurse's knowledge of accurate specimen collection procedures. The phrase, most important for the nurse to include, emphasizes the precision required for a 24-hour urine collection. The entire 24-hour collection must be complete and accurate to reflect the total amount of substances excreted by the kidneys over that period. Missing even one void invalidates the test results because it compromises the cumulative measurement. For example, if a patient forgets to collect a void, the lab results for creatinine clearance might be inaccurately low. Always stress the importance of collecting every single void to ensure the accuracy of a 24-hour urine test. Question 24. A nurse is preparing to administer medication via a gastrostomy tube. After checking the residual volume, the nurse finds 200 milliliters. The policy states to hold for residual greater than 150 milliliters. What is the most appropriate action? A. Administer the medication as planned, as 200 milliliters is not significantly high. B. Dilute the medication with more water and then administer it. C. Return the residual to the stomach, hold the medication, and notify the prescriber. D. Discard the residual and then administer the medication. Answer: C. Return the residual to the stomach, hold the medication, and notify the prescriber. This question tests the nurse's critical thinking and adherence to policy in enteral feeding and medication administration. The keyword residual volume: the nurse finds 200 milliliters and policy states to hold for residual greater than 150 milliliters clearly indicate that the medication should not be given. The most appropriate action is to return the gastric contents to prevent electrolyte imbalance and then hold the medication, notifying the prescriber for new orders or assessment of feeding tolerance. For example, administering more fluid into an already full stomach could lead to aspiration or vomiting. Always follow institutional policy for gastric residuals to prevent complications and ensure safe care. Question 25. A nurse observes an unlicensed assistive personnel, UAP, leave a confused patient's bed in the high position with the side rails down. What is the nurse's immediate action? A. Document the UAP's unsafe practice in the patient's chart. B. Remind the UAP about bed safety at the end of the shift. C. Immediately lower the bed and raise the side rails appropriately. D. Discuss the incident with the charge nurse before taking any action. Answer: C. Immediately lower the bed and raise the side rails appropriately. This question assesses the nurse's prioritization in ensuring immediate patient safety, particularly when observing an unsafe situation. The keywords confused patient, bed in the high position, side rails down, and immediate action emphasize a direct and urgent intervention. The nurse's first responsibility is to protect the patient from potential harm, such as a fall, by immediately rectifying the unsafe environment. For example, a confused patient could easily roll out of a high bed with side rails down. Always prioritize direct action to correct immediate safety hazards before any documentation, teaching, or reporting.